This is Adrian. He complains of dizziness after eating sugary food, such as caramelized sweet potato and pancake with maple syrup. Few years ago, he was sent to urgent care due to heart palpitations and dizziness. However, diagnostic test results show that he has no heart attack and diabetes. His hemoglobin A1C was 5.0, normal, and glucose level is normal. He cut beer, wine, soda, and fruit juices. He also tried low-carb diet but still experiencing the symptoms. What could be the hidden cause of Adrian's symptom? Adrian is a 42-year-old screenwriter, with multiple side jobs living in an apartment with roommate. He loves to eat pasta on a regular basis and store-made berries. His usual breakfast for 10 years consists of oatmeal with milk, almonds, and wheat germ. The symptoms began 4 years ago. He complains of dizziness or lightheadedness after eating, especially sugary food. He feels this symptom after eating pancake with maple syrup, caramel-iced sweet potato, pasta, and cinnamon toast with milk. He also feels the symptom after drinking carbonated drinks and fruit juice. He tried to change his diet into more protein and fats. Veggies, eggs and almond butter makes him dizzy after 4 hours. He also feels bad after eating protein from meat like chicken in olive oil and garlic sauce. Adrian has no rashes, discolorations in any part of his body. He has obsessive-compulsive disorder, OCD. He has no heart issues but has chest pain, and feeling asthmatic after eating too many dried apricots. He has slight abdominal pain after eating too many berries and vinegar. Adrian has problem with meniscus in left knee. He has broken left shoulder. He also has tendinitis on the right shoulder. He was able to address these problems through physical therapy. His grandfather died of diabetes. Grandmother has colon cancer but was able to survive. Father has post-traumatic stress disorder, PTSD. After World War I, his cousin has diabetes. Adrian changed his diet into low-carb, more protein, and fat diet, in hope to alleviate his symptoms. His breakfast of veggies, hard-boiled eggs, almond butter, and berries, makes him dizzy after 4 hours. His lunch of veggies, lean meat in olive oil and garlic sauce, with brown rice makes him dizzy as well. Adrian sleeps 7.5 hours daily. He was so stressed with his work but therapy helps his anxiety. He exercises 3 times a week. He minimizes drinking soda and drinks alcohol socially. But sometimes he eats wheat, pasta, sandwiches, oatmeal with almond and milk. Adrian took antihistamine drugs, but stopped because they are too strong and have no effect on him. Currently, he was not taking any drugs. Let's take a look on Adrian's test results. His carbon dioxide is low on the first test, but becomes normal on second and third test result. Low carbon dioxide leads to hyperventilation. A low lymphocytes and elevated neutrophils signify infection. Is infection the main cause of Adrian's dizziness? There are fluctuations on the glucose results. Diabetes was ruled out on first result, especially that his hemoglobin A1C is normal. A high glucose means diabetic and a low glucose means hypoglycemia. What is the meaning of these fluctuations of glucose levels? Other test results show that Adrian's creatinine and calcium levels are normal. His vitamin D is slightly below normal. His HDL and LDL are low but triglycerides are normal. Adrian has a very high ketone levels, low glucagon and testosterone. Tryptase is the most abundant enzyme released by mast cells. It metabolized histamine. It is elevated when there is mast cell activation. So, mast cell activation syndrome is ruled out as the cause of Adrian's condition, since the result of tryptase is normal. Adrian is negative for malabsorption and SIBO. He is also negative for Lyme disease, but positive for Epstein-Barr virus. The main diagnosis for Adrian is reactive hypoglycemia. However, there are more to this diagnosis based on other lab results that we need to address. 1. Adrian has leaky gut. The excessive consumption of refined carbohydrates can damage the gut lining. 2. Infection. He is positive for Epstein-Barr virus. 3. Imbalanced microbiome. It is a surprise that he is negative for SIBO despite of eating a lot of refined carbohydrates for a long period of time, so repeat test is necessary. 4. Adrenal fatigue. Excessive sugar in the diet and stressful lifestyle can cause adrenal fatigue. Also, an elevated ketone level is a sign of adrenal fatigue. This causes his testosterone levels to drop. Let's talk about Adrian's infection. The long-term consumption of refined carbohydrates and wheat from pasta, bread, cereal, pancakes, and excessive sugar from soda, alcohol, milk, cheese and dairy alter the immune function. Wheat contains indigestible polysaccharides that promote small intestinal bacterial overgrowth, SIBO, increased intestinal permeability, leaky gut, and inflammatory state. Because of Adrian's dysfunctional immune system, he is more prone to harmful microbes such as viruses. Adrian is positive for Epstein-Barr virus. This is the structure of the lining of the small intestine. Normally, small intestine absorbs nutrients, but is impermeable to viruses, bacteria, parasites and other toxins. The damaged intestinal lining of Adrian makes it easier for bacteria, viruses, and toxins to pass through it. In addition, Adrian is alcoholic. The alcohol inhibits the absorption of nutrients in the small intestine, while increasing the transport of toxins across the intestinal walls. Let's talk about Adrian's reactive hypoglycemia. Hypoglycemia is caused by excessive intake of refined carbohydrates, like bread, pasta, and cereals. Alcohol consumption severely stresses blood sugar control, and is often a contributing factor of hypoglycemia. It affects organs, specifically liver and pancreas. For Adrian's case, it's reactive hypoglycemia. Because 1. There are fluctuation on his blood sugar levels. 2. He shows signs and symptoms of hypoglycemia, like dizziness or lightheadedness after 4 hours of eating a meal, especially sugary food. 3. His symptoms resolve by eating complex carbohydrates. He stated that he feels better when eating every 2 hours. Because of the very low blood glucose levels, the body will use other source to combat hypoglycemia, the fatty acids. Fatty acids byproducts are acetone and ketones, or hydroxybutyric acid. The liver and glucagon hormone from alpha cells of pancreas are responsible for elevation of ketones. Adrian also has metabolic inflammation, refined carbs, Epstein-Barr virus, dairy, eggs, and toxins activate TLR4. TLR4 activates NF-κB. Activation of NF-κB, an inflammatory pathway, inhibits insulin receptor function. This results to mitochondrial disruption and endoplasmic reticulum stress, ESR. What is the treatment plan for Adrian's case? 1. Diet. Low-carbohydrate Paleo-Mediterranean diet is recommended for Adrian. Avoid common allergenic foods such as wheat, eggs, dairy, milk, cheese, and wheat germ. For hypoglycemic diet, eat whole grains, raw, and simply cooked vegetables, some fresh fruits. But eat in moderation starchy foods such as brown rice and yams. Eat high-fiber food. What to avoid? Refined starches, sugars, high meat diet. And too much salt because it exhausts the adrenals. What to eliminate? Nicotine, alcohol, chocolate, soda, soft drinks, black tea, caffeine, tobacco, and fatty foods. During a blood sugar reaction, eat something that has both fiber and protein such as ground flaxseed. 2. Antiviral. The better antiviral strategy consists of 4 components, so the virus won't replicate. The components of the strategy are treatments that target the virus itself, stop the replication of the virus, supports immune system as well as the human cell. Antiviral is the use of treatments that target the specific virus. Best antivirals are licorice, papaya juice from leaf, lemon balm and selenium. However, we cannot use licorice for Adrian's case, because he has low testosterone levels. Licorice can aggravate the low testosterone levels of Adrian. 2. Anti-replication. It is a treatment that inhibits the viral use of human DNA, to avoid viral replication. Recommended supplements are lipoic acid and N-acetylcysteine, NAC. 3. Immune nutrition. Is a treatment that can stimulate immune function to fight against virus. Recommended supplements are combination of glutamine, arginine, and omega-3 fatty acids. Vitamin D3 and vitamin C also supports immune function. 4. Cellular support. Is the treatment that enhance function of mitochondria and endoplasmic reticulum to promote recovery and prevent recurrence. Examples are multivitamins, probiotics, exercise, and massage. 3. Detoxification. Examples are bowel cleansing, sauna, laxatives, and chelation for heavy metals. When doing detoxification, it's important to have a balanced microbiome, to avoid reabsorption of toxins. 4. Downregulate TLR activation. Recommended treatments are NAC, flavonoids bacaline, Scutellaria bacalensis, apigenin, many fruits and vegetables, especially parsley, celery, and chamomile. 5. Balance hormones. Adrian has low testosterone and glucagon. Let's talk first about testosterone. Testosterone is one of the anti-inflammatory hormones, along with the DHEA and cortisol. Adrian has low testosterone, and we need to elevate it with anastrozole, arimidex, and rhodiola rosea. Low glucagon leads to altered gluconeogenesis, so we need to elevate it. Alternative treatments for licorice are Gentiana scabra, and oral glutamine supplement. Other herbs that can control the blood sugar levels are: cedar berries help the pancreas. Spirulina stabilizes blood sugar. Milk thistle contains silymarin which helps the condition. Ginger works indirectly to help increase the availability of dietary nutrients, for digestion and metabolism. 6. Correct dysfunctional mitochondria. NAC and coenzyme Q10 are best supplements to correct mitochondrial dysfunction. 7. Nutritional supplementation. Chromium is a well-known supplement for hyperglycemia, as well as hypoglycemia. Do you have friends and family who have cancer? Check out the link in the description. In this course, you will discover the single cause of all types of cancer, and the step-by-step guide to cancer management, without undergoing expensive and toxic cancer treatments.